Welcome to another episode of We Could Think Development Out Loud. Today, we're joined by Dr. Fifa Rahman, who is a principal consultant at Matahari Global Solutions and currently a visiting fellow at the University of Warwick. She's a specialist global health lawyer with a PhD in political economy and trade-related intellectual property for biologic medicines. During the COVID-19 response, she was the lead civil society representative for the ACT Accelerator, responsible for consulting global civil society and distilling findings in coordination meetings during the acute phase of the pandemic with heads of agencies and diplomats. Thanks for joining us, Dr. Rahman. First, could you tell us about your previous work on the COVID-19 response and how this has led into your ongoing scholarship on pandemics?
Thanks very much for the question. So my role during the COVID response was as the lead civil society representative to the Access to COVID Tools Accelerator, which was essentially the pandemic governance mechanism. So decisions about vaccine deployment, test deployment, therapeutics was decided on this platform. And what I experienced during the COVID response and being in the room with decision makers day in, day out, diplomats, trying to understand why there were inequities and why certain decisions were made without inclusivity, made me realize that it was a very ineffective pandemic response. And this has transitioned into my work, including work at Warwick, on how do we create a pandemic response that is effective for the future, that actually works in securing supply chains for the countries most in need, that works in terms of saving time in not making mistakes in the first place about country contacts, about logistics. And because we are likely to have a pandemic as serious as COVID or more serious than COVID in the next 25 years, it remains quite a critical agenda to make sure that we get it better or get it right the next time around.
Thank you very much. Next, could you tell us more about how your work was done in terms of methodologies and principles?
So at first, I don't think that I had a particular philosophy in mind or approach when I went into the meetings and the work on the ACT Accelerator. But as I progressed through time and realized that in different groups of decision making on the COVID governance mechanism, that decisions were skewed. They were not good decisions because they were being made by people who had zero context about the local environment. They had zero context about what was happening in the country, and they did not have the networks to call the right people to the room. That's when I began to take a decolonization approach. And there are so many examples of this. But for example, there's a group called the Principles Group, which was part of the ACT Accelerator governance mechanism, where you had the head of the World Bank, the head of the IMF, key diplomats, the head of WHO, in the room every Thursday during the acute phase of the pandemic, discussing decisions and how do we reach those decisions. And there were several times when it was clear that decisions were being made without the expertise of people who live in those countries. One of the biggest examples of this is when DRC and South Sudan returned vaccines to the COVAX mechanism. And the reason why these were returned is not only were the vaccines close to expiry, but also there had been no consultation about how much demand creation would need to be done. Whether traditional leaders had been consulted and what role traditional leaders in their villages would have about alerting people to the vaccine, telling people about the vaccine, there had been no time, no warning to do a health communications campaign about what COVID was about, what the risks to your health were. And there had been no previous confirmation with the governments as to what logistics they would need, especially to go to remote areas. And some places in DRC are accessible only by four-wheel drive. So that means that there's a lot of logistics arrangements that you would need to do to arrange for four-wheel drives. And of course, the early vaccines were reliant on cold chain technology. So are there warehouses or facilities with the relevant fridges and freezers to store the vaccines? So all of this had not been considered before certain vaccines had been deployed, and both DRC and South Sudan returned the vaccines, which was a massive waste of time and resources, because of course planes had to be chartered to bring these vaccines to the areas where they were to be deployed, and ultimately the vaccines were sent back. When I started reflecting on decolonization and the fact that people are so systemically stuck in their systems of white supremacy and patriarchalism, that they believe they have the technical knowledge to make the decision about the deployment without consulting experts who know about the logistics, who know how many facilities they have for storage of vaccines, to know how much money they need to mobilize four-wheel drives and communications campaigns and engagement campaigns with traditional leaders, etc. If they had just had an expert from the Ministry of Health of DRC, the procurement agency of DRC, the social and behavioral change people from DRC and South Sudan, they wouldn't have needed to send the vaccines back and waste the money. So there were a lot of things like that it was quite clear that there was money wastage, time wastage, due to the fact that folks just did not think about their privilege, did not think about the fact they did not have the necessary knowledge to deploy vaccines effectively. And this is why decolonization as an approach and thinking also about democratic legitimacy of these governance mechanisms started to become a real thing. And you start to realize that in order to have a mechanism that works for the global South, it needs to be done with these principles in mind.
Lastly, the pandemic agreement may be open for signing this year, depending on what happens in May 2026. Could you reflect on some of the challenges and barriers you faced and how we can tackle these in future pandemics?
So I've spoken about a couple of the challenges, and I think the biggest challenge that came out of the COVID pandemic, it was quite clear that inclusivity was foregone in the name of agility, and there was a clearly quite broken governance mechanism of the previous pandemic. This has unfortunately resulted in distrust, but completely foreseeable that this would have resulted in distrust towards the global north. And we are seeing this also in the pandemic agreement, where this week, where they're having negotiations on one of the annexes of the agreement, developing countries have refused to negotiate based on the text issued by WHO, because they believe that the WHO is pandering to the global north. So institutions will have to materially change, and these barriers and challenges continue to exist. Of course, multilateralism is being mistrusted by all parties. We have Argentina and the United States obviously withdrawing from the WHO, but also a lot of distrust by developing countries as to where multilateralism is going. And at the same time, there is an opportunity here for us to make regional institutions better and more empowered to do the work they do. And this includes Africa CDC, I know there are discussions about the development of a LAC CDC, a Latin American Caribbean CDC, and also organizations like ASEAN, which right now is quite weak in the roles of health security and in their mandate to discuss health and security for the region. But there is an opportunity in light of reducing multilateralism and the clear need for stronger regional institutions that we need to tackle. And in terms of the challenges, I do think that there continue to be a lot of people who decry decolonization as an approach to this. They think it's a tick in the box thing. But with the examples, you can see that having a decolonized approach is really a question of not just ticking a box of having people of color in the room, but really helping to ensure that your decisions are made with the correct information. And that continues. So to summarize, we have continuing barriers as to depleting multilateralism, the need for further investment in regionalization and regional efforts, but also the continued deprioritization of philosophical approaches that really make the work we do better and more effective.